Before we begin, make sure to subscribe to the Future Media channel, give this video a like, and leave us a comment with what you think. Now, let's talk to today's future maker. Dr. Marianna Prokopi-Demetriades is a biotech entrepreneur, clinical associate professor in research oncology, and co-founder of not one, not two, but 3 Cyprus-based biotech companies: Theramir, RSL Revolutionary Labs, and Promed Bioscience. Her work focuses on turning oncology research into patient-focused solutions, from cancer therapeutics to regenerative medicine and supportive skincare for cancer patients. Marianna, welcome to the Future Makers podcast.
Thank you very much for the invitation. Lovely to see you.
It's lovely to see you too. I like to start with how I always start my conversations, and that is with a quote from Kierkegaard. Kierkegaard says, "We live life forwards, but understand it backwards." Now that you have lived a lot of lives, I think, how do you understand who you are today, looking back to your early years?
You know, this is one of the deepest questions that I was called to answer in a podcast. Thank you very much. It makes me think.
Good.
It's really difficult to answer it. I think what happens when you are smaller, younger, children, it prepares you for your life. It prepares you for the future. And it's always making you think why maybe something's happened to you, if that's part of, the more general purpose that you might have in life. And unfortunately, my life was full of traumas. And, instead of thinking that it was unfair and why these things happened to me, I love to take them as, challenges and return back to life something positive. So I think it's maybe a preparation for what life has for you. And it's a wonderful challenge, and I wouldn't change it for anything.
That's a very positive light to start on. You grew up in Athens, if I'm correct. What was the city like whilst you were growing up? I'm talking about both like the physical location and your community. What were you seeing around you, and what were, some of the moments and experiences you think have really influenced how you were growing up?
Look, Athens, it's an amazing city. It's a big city for a young child, but I was very, very lucky, and I grew up in the 80s, so we still had the sense of the neighborhood. So I still remember myself playing football with the rest of, the children in the middle of the streets. However, as you were growing up and as a young woman, it was always challenging to go out. It's not like Cyprus that you're going to leave the children out even when they are 11, 12. And because I was raised only by my dad, he was very strict of, what a young girl can do by herself or not. So it was a very protective environment. But I was very lucky to travel around Greece for holidays because my grandmother was from Lefkada, a beautiful island, the other grandmother from Volos. So every summer we're going around all over Greece. So I have the ability to meet new people, new friends every summer. You have this freshness of what Greece has to offer to you, good food, amazing traditions, and this is something that I want to, transfer to my children as well, because unfortunately we are losing this sense of belonging and the traditions that we carry over. So even though many traumas in my life, I was very, very lucky to live also a little bit the village life and the metropolitan life of Athens.
Who were the women in your life? And what was your understanding of womanhood during those early years?
Ooh, difficult question. Yeah, I mean, I grew up with my mom until I was 9 and I lost her. So she died. But during this year, my dad was working in Saudi Arabia. So I was raised by mainly my mother and my grandmother, her sister, and the great-grandmother. So, I always had women around me. Unfortunately, none of them was lucky enough to study. They didn't allow them to study in the university. So I was the first woman in my immediate family to go into university. So it was always a challenge for me that I wanted to break the stereotypes of my family. But after and for quite a lot of time, I didn't have any, mother figure around me. So I became the mother figure in the house. I raised my younger sister. I was the person responsible to take care of the household. So I think it was quite a responsibility. But while I was growing up, I had the mother figure of my mother that she wanted to take care of everyone. I think I still do that, and I love doing it. So, yeah, even though there were many, many absences in the life that I had, I'm trying, to copy what I learned in the first, 9 years of my life.
What led you to actually take that decision to go and study, especially since you didn't have those models in your life? And what was the reaction of your immediate family?
I think I took two hard decisions. The first decision was to go into the more medical-related subjects that nobody in the family, the immediate family, had any access to except from my aunt and my uncle, that they are both in the medical profession. But for some reason, I loved the microscopic world. I was always either, watching documentaries about biology, biomedical sciences, or trying to do, short internships in hospitals, but always in the diagnostic lab, not in the corridors of the clinics. And secondly, a very hard decision that I took was to go abroad and study. For many, many years, I felt trapped in the family, the household, and, the really bad experience that I had as a child. And I just wanted to leave and create something of my own.
And what was your reaction of your family? I mean, not only are you going to do a subject that was not really open to a lot of women at the time, but you're also leaving Greece for London.
My dad was always supporting me, and he was always trying to tell me that, especially because we are women, we have to be independent, either financially or by having a profession that we love. So I had the support of my dad, and that was great for me. I still remember the day that I was leaving for the UK. He was in the airport, and he returned back to me, and he said, children are like, the little birds. They open up, their hands, and they leave from the house, they fly away. And he was sure that I will never come back. I will never return. So he knew it. He knew it.
How difficult was it to leave your sister?
That was the most difficult part for me because when my mother died, she was 3 and I was 9. So I actually raised her. And, she was in such a sensitive age that I don't think she could process the fact that it was my time to leave from home. We didn't have a very close relationship for the years that I was away, but she was diagnosed with cancer in 2016. And for 2 years, even though they were the last years of her life, I brought her in Cyprus, and we spent the last 2 years with her very, very closely. Now you make me cry.
So sorry.
But, it's things in life that you have to take on and change and maybe correct. So for me, it was a correction.
Trying to make up for some of the times you were apart. How old was she when she came to Cyprus?
She was 28 and she died when she was 30. So 2 hard years.
2 hard years.
But it was wonderful because I had my children and, she met them. And, but the thing is that because he was a chemist as well, we were having making dreams of maybe we can work together and, work on cancer research. And she loved making cosmetics in her house, little soaps and body milks. And one of the companies that I have now, it's, dedicated to her life. So I think I will always carry her with me and in what I'm doing.
In a way, I guess maybe you might have also inspired her to go into the
yes,
field.
Possibly.
Yeah.
Yes.
So in a way, maybe even though you weren't close, I think there was something.
It's a good point.
she was moving towards.
Yeah.
Let's go back to you and you. So you leave Athens and you have a heart for the sciences. What kind of drove your passion when you started studying? What were you most interested in?
Maybe because I had so many deaths in my life, I wanted to, become useful and maybe correct things, but correct them going way back in research and, why things are happening and how you can find solutions and maybe creating therapies or diagnostic tools that can help you prevent a disease. I spent my student life in the UK in 3 great universities. University of Kent, that it was a very traditional university in the outskirts of London, with a great campus, great teachers. The Department of Biology on the 3rd floor, if I remember correctly, we had a spin-off of Pfizer pharmaceutical. So it was a great, first idea of how the academic work can be in collaboration with a big pharmaceutical company. Then I moved to London, in London School of Hygiene and Tropical Medicine. It was a postgraduate school, one of the oldest one. I think it's maybe number 1 in the UK for public health and number 3 in the world. Very, very traditional. I still remember the amazing library that we've been at. It was the first time that I came in contact with such an international student population, and I made friendships from Taiwan, Africa, the US. So it was unbelievable. And also the fact that you could do so many things with what you're studying for, the greater good of the universe. And then King's came, and King's for me has a big part of my scientific career. I was very, very lucky to work at the King's Hospital in the James Black Center. I met him and he mentored me for a little bit. He was a Nobel laureate, so it was incredible from, a young woman coming from Athens without anything in her hands, meeting, such unbelievable people. I spent 4 years in King's. Very lucky with my project. Within the first year, we published the work I did, and that opened up, the field for me to do whatever else I wanted to bring in King's. It gave me the opportunity to go at Hanover Medical School for a shorter training as well and bring some new knowledge back to King's. So very happy, very, very happy with, all the different universities that I attended in London.
What were you researching at the time?
In King's, I was in a very hot topic at the moment. I was working on stem cells and how we can work with stem cells to create new therapies for the cardiovascular system. Very high-tech, new field for me because traditionally I was working on microbiology and bacteria and yeast. So suddenly you are in, deep tech science. We were working in very close collaboration with the King's Hospital. So we had access to patient samples and access to samples from a very big clinical trial, around 800 samples. So we're working mainly of creating therapeutics, but at the same time, we created one of the first prototypes of liquid biopsy diagnostics for diabetes type 2, based on microRNAs and extracellular vesicles. So many unknown words for me, but it was a great experience.
I mean, it must have been so exciting. You were among like the leaders in the field, and constantly something new, you are creating something new as well. So,
and we didn't even have the tools to do, the analysis. So we had to set up like new tools, new analytical steps. So it was chaotic, challenging, but amazing.
And so you're at this high. What did you picture your life at that time to be? Post, obviously there was going to come an end to King's. What were you seeing in your future?
So it was pretty basic. The future was like pretty much planned. So you're finishing your PhD. Then I had an offer for a postdoc, and I had an offer to become a lecturer at Imperial, which I said no. And I followed my husband in Cyprus.
That must have been a very heartbreak.
Yeah. I mean, you just think how naive I can be when I am young.
Yeah.
But, it's at a crossroad that you have to choose between your professional life and your personal life. Mm-hmm. And my dad was always saying to me that life is two major fields. You need to be 50% happy in your professional life and 50% happy in your personal life in order to have 100% happiness in your life. So both of these sectors are major for you. And I think at that point, I chose my personal happiness. And I knew that because I was always very, positive in my life, that even though I'm giving up of something that I know is going to give me great success and happiness professionally, that maybe at some point I can earn the same thing back in Cyprus.
Well, I mean, you got an offer from Imperial College. And I mean, I'm assuming you get on this flight to Cyprus and you think, okay, well, they're going to lay the red carpet for me. I got an offer from Imperial College. Like all the university doors will be open for me. Was that the experience?
That's what I was expecting, and you're right. But no.
No red carpet from Larnaca Airport?
No red carpet. And the problem is that I realized quite later in my life. I came in Cyprus in 2010. At that era, we had only 2 public universities, and the private universities, they were starting to, to operate. Not many positions available, especially for tenure. So maybe you could find something research-based, but still you had to apply for a grant. So yeah, different reality. I will be truthful, I didn't expect that reality for me. So my first job was in one of the 2 biggest pharmaceutical companies in Cyprus, that I lasted 9 months and I quit. It was completely different from what I wanted to do in life, but going back now, it was a great lesson. And, nothing in your life, nothing that you do in your life, it's without any point. Now, I mean, that we have our own production and manufacturing, you're going back of how, these companies are working, and you're trying to remind yourself and work with the same, standards, because they are very, very accomplished in what they're doing, and one of the, the biggest exporters from Cyprus. So you only have to, sit back and replicate what you learned there. So no bad feelings. No. It was a good training for me.
So those years before you started your companies, how would you describe them? Especially, professionally. I'm guessing the 50-50 wasn't exactly working out.
No. It was a disaster.
Oh, gosh.
Complete disaster. I mean, everything that we were starting, was not going into success. So first was that job. Then I was very, very lucky to get a grant with the Research and Innovation Foundation and the Banco Cyprus Oncology Center. Start working on a spin-out of Imperial College based in Cyprus. However, the financial crisis started, so we couldn't continue with the company. Then I moved into the Cyprus University of Technology, working part-time on a few projects. And then I registered myself to the unemployment services for 4 years. So that for me to go and, bring my 4 degrees and say, okay, with this curriculum and CV, I cannot find a job was like a really, a wake-up call.
Yeah.
Very, very hard. And, at the same time, I lost my dad from cancer, which I had to care for, and my sister was ill, and I had my 2 children, and financially, I wasn't in a good, place. So you also feel the responsibility that, as an adult, you cannot provide for your family as well. And you start thinking, okay, why did I study for 11 years? So I think it's, that's how life works. You can never, expect that everything will be 100% happiness and 100% success. So, okay, you learn from this, either mistakes or, from life. And the thing is that you have to rethink and restart.
So what was the first company that you had the guts and the courage and I don't even know how to say it, the whoosh to start?
It was Theramir, which is like, a very deep tech. As I say, it's the jewel of what we have created so far and the most difficult to succeed. It's a black box that you just put money in and you don't know if you're going to have something useful out of it in the next 10 years.
Sounds like a child completely.
Yes. So it's the typical biotech. The biotech that starts from idea, from a hypothesis, and the hypothesis is how we can cure cancer. So a huge challenge. So in Theramir, we have established and we have patented a technology that works by targeting LCP1. LCP1 is one of the newest oncoproteins that they are present in more than 20 different types of cancer. We have identified a microRNA that can regulate the expression of this protein, and we have tested it in preclinical testing, including animals, in triple-negative breast cancer, and now we expand the portfolio in bladder cancer and pancreatic cancer. So very difficult cancers to cure. We were going for the traditional model that we want to kill cancer cells, but we didn't exactly find that. We discovered something different. We discovered how a cancer cells, we can, change the phenotype and become back to normal. So this is what cancer reversion, how cancer reversion works. And also we identify that in late stages of metastasis, we can stabilize the metastasis and also prevent the metastatic progression. So this is going to be one of the first-in-line breakthrough therapies that we're trying to put in the market. How amazing it will be to have Evmir, which is our therapeutic model, to be a companion therapeutic with other therapies in order to prevent metastasis at later stages in patients.
So what, just going back a little bit, what are the treatments available to cancer patients? Obviously, each cancer is unique, but there are similarities between. And why do you think there was a gap in the market that you thought you needed to come in?
Look, cancer is a very complex disease. It's a group of diseases. Everyone is completely different from each other because we bring in genetics, we bring in mutations from the environment, different lifestyles, different ages that we realize that we might be a cancer patient, different metastatic stages as well. So everything has to be so personalized. We pick up to work with triple-negative breast cancer that for many years the only available solution was either radiation therapy in some cases, surgery, and the traditional chemotherapy. We are very lucky in the last month we see repurposing of some more specific drugs to work on triple-negative breast cancer and give some extension in life, which is amazing news. So we picked one of the very difficult cancers to cure because this specific cancer, as it say with the name, is triple negative. So it's negative for all the biomarkers that they are known for breast cancer. So there is nothing specific that you can hit it with. So we identify one novel protein that it is very, very present, at least 50% more expressed in triple negative breast cancer. And we identify one of the little modulators that we can down-regulate the expression of this protein. So, and the way that we are doing that is very targeted and specific. We have created a very nice nanovehicle coming from stem cells that can carry this microRNA through the blood circulation and identify only the tumor microenvironment. So to be specific and not hit healthy organs is very, very important in cancer because we have many, many patients, including my sister, that you don't die from cancer itself or the type of cancer that you have. You die from necrosis of your liver or your kidneys because of the toxicity that the chemotherapies provide to your organism. So to create something that it's friendly to you and try to be specific and prevent the metastatic progression, I think it's going to be major in the next years.
It will be. What was the initial reaction to, you once you started the company and you were kind of sharing what you are working on? What was the immediate reaction of maybe like the community or even like more of the global community?
Look, when you have two crazy people setting up a company without even a patent and just an idea, nobody is trusting you. Nobody will provide for you. So it was really, really difficult, especially when you are in Cyprus, that we don't have a very well-known or expanded biotech ecosystem. If you were, for example, in Boston, working in one of the universities, the big labs, and you share in the news, you have like so many teams to come and support you. You have access to big grants. Here, the situation was completely different because for 7 years during the financial crisis, we didn't have access to any grants. So we had to go out and, seek money from private investors. What was really, really difficult to convince them, because we had nothing in our hands. No our own lab, no materials to work with, no patent. So the first money that were invested in the company, we invested it by applying for a patent in order to protect the asset of the company. Now we are in a very much better position. We have done a lot of work in order to prove the concept of our therapy. We are in the phase that from last year that the patent was granted, we are allowed to publish our results. We've been in 3 conferences so far, and we got an award last year in the London Breast meeting for what we are creating. And now we are in the phase that we're going to publish the whole work that we've done for the past 7 years. So that's, the work of a lifetime for me. And now we are entering a new phase in the company that we will go through the GMP manufacturing of the drug in order to apply for IND and enter clinical trials, hopefully, and based on the budget that we have in the next 2 to 3 years.
So like you said, it is a company that there is in the future you will see a product, but it's a very long road towards it. And I guess that's where, the resilience and you need a sustainable model.
And the risk.
And a huge risk.
Yeah. Because only 1 in 10 companies in the biotech can, see a product in the market.
And especially if you're not local investors are just not really seeing it. They don't have experience in the field. And they are much rather invest in something that
it's safe and
safe, comfortable. They kind of know that, in a year's time, we're going to see something. Whereas here, they have to believe in a vision and in the team.
However, I have to say that the people that supported us so far are local people. Local people that, they wanted either to risk or they believed in the vision, they believed in the founders, and they wanted to support something that Cyprus can bring out in the international market. So we have to be very, very thankful to them that, they believed in what we are doing and they keep supporting us, because without them, we wouldn't be here today. So yes, you need to educate your investors, you need to educate local people, and you need to, make them aware that Cyprus can offer other things except from real estate, fintech.
Yeah.
We have biotech as well now.
Yeah.
And the Research and Innovation Foundation invested heavily in biotech, in life sciences, either through the academia or through the small biotechs that have been created so far. So I see a new model of what Cyprus has to offer. The only thing that I want to ask for is that the local business community has to see that as well. So how you create an ecosystem is not only when the academics, the researchers, and the promotion foundation and the small companies work, is when bigger companies, bigger pharmaceutical companies or biotech companies come to support the ecosystem and create local innovation.
Exactly. And that is how you kind of create this community of people working. Is at the end of the day, who are you benefiting? The people who will be buying from the pharmaceutical companies. And so they need to think of their clients and their customers.
And the fact is that 67% of innovative drugs that they are currently into clinical trials are coming from small biotechs. Because all the R&D now it's outsourced. It's done from small companies. Yeah. So you need the support of the big pharma. You need the support of the manufacturer.
Go to the second company. What was the second company that you opened, and how far down the line were you excited to open something new?
The second company, I don't know where it came from. It was the idea of my co-founder, Kostas Pitsilidis, that suddenly he thought that there is a lot of interest in biomaterials, and especially biomaterials that their basis is collagen. Not the collagen that you might be familiar with in the supplements or in the creams, the collagen that works as a raw material in fillers, injectables, bioprinting of artificial organs, and tissue regeneration. So very high quality collagen for medical applications. So the idea was that this company will be like an easier company to set up, maybe to get some financial gains earlier than Theramir, that it's going to take like 7, 10, 15 years. So we started Promed Bioscience very naively. That's going to be a very easy project. The idea was to produce collagen for R&D. And when I say R&D, I say for either companies that do in R&D, companies or universities that work on research, and they need collagen to grow cells, cell cultures, or bigger research centers that the first material that they use to grow cells, it's again collagen, or they want to play around with bioprinting that was very, very fancy a few years ago. We succeeded to produce the collagen. We succeeded to become part of, big catalogs like Thermo Fisher Scientific and Merck. Maybe we sold like 3, 4, 5 vials, not more than 10. So great idea, great material, succession into manufacturing it, no market. So we had either to close the company or pivot a little bit. And we found a niche market, the market that you can collaborate with bigger companies that they work on collagen biomaterials and collagen-based finalized products, but they don't have the experience to go through the regulatory approvals and do large-scale manufacturing of collagen. So we are in the middle of the R&D researchers and big companies that they want finalized products based on collagen. So we work for a few years for free with a few big companies that they are in the area of bioprinted materials, bioprintable organs, injectables. And we are finally end up with signing big contracts of around 30 million, 35 million for the next 5 years of minimum orders. So we work a lot with South Korean companies, US companies, and now we possibly gonna end up with new contracts with companies from Germany and France. So yeah, we're very, very proud that a small Cypriot company exports collagen internationally, and it was something that we didn't expect. But for us, it was a dream to work with high-end biomaterials that I can actually end up be transplanted into a human body.
It's incredible, especially I am guessing you had to set up your own labs here and start all from scratch. So there was a lot of, passion going behind that, and to see the success and being recognized by big international names, thinking, okay, let's find this place on the map first of all.
Yes.
And entrusting you to create these enormous contracts. And what did it feel like, signing that first contract?
Look, it's you can't believe it because you suffer for so many years. But once you sign the contract, you don't feel success. You feel that you have to expand in order to have the capacity and accommodate the needs of your customers. At the same time, it's a huge responsibility because you have to be an FDA-approved supplier. You have to, work under ISO, which is the international standards, GMP, good manufacturing practice. So there is no time to waste for celebrations, unfortunately. You're just going into a momentum of huge responsibility, and I have to be committed and deliver on time because you have only one chance. You don't get a second chance.
No.
So everything has to be perfect.
Yeah, especially it's this thing of like the reputation of your company. It's like you're saying, you get this one chance. If something goes wrong, the whole international ecosystem will know it, and you will be blacklisted. So it's a tightrope to walk on, and yet you still opened up a third company.
Damn it!
Even though you were already on the tightrope.
I will never learn from my mistakes.
No, you're like, okay,
we can do this.
I'm busy. Let's do something else.
Yeah, right. Now that you're saying that, you're correct. But, we never started by saying, we want to open up like 3 companies, 4 companies, 5 companies. It was just, a matter of, growing up and, see the needs. And for me, it's not just companies, it's the vision. For me, the vision and the purpose is that I want to create materials, to create solutions for people in need. And, with the Collagen now, we work with a beautiful company that they're doing. We produce for them collagen bioink, and they do bioprinting of lymphatic nodes, especially for women that they suffer after a mastectomy, that their lymphatic nodes removed and they end up with lymphedema. So for me, it's all about, improving the quality of life for cancer patients and oncology patients. And, this is my vision. So with the third company, after my sister died, after a couple of months, I just wanted to create something to honor her memory. She suffered a lot from, skin side effects from all these treatments that she had for 2 years. So she had like radiation burns. She couldn't, wear properly her clothes because of all these different and difficult creams that she was using that they were not providing her with, any comfort. Or she had like erythema on her head and she wanted to put like a wig and she still couldn't wear a wig because, all these blisters. Or she wanted like, it was in the middle of the winter and she had to walk around with flip-flops because, her toenails were, destroyed. So things that you don't think that they are major for a oncology patient, but they take their toll in their quality of life. And, if a person has like a few months to live, at least, you need to live with, at a good state. And when you are carer of these people, you feel the pain. So for me, it was always an internal fight of, okay, I am a cancer researcher. How did I accommodate the needs of my sister? I've done nothing. So after a few months, in her memory, I found my co-founder, Anna Christofini, that she was working for so many years on, natural products. Her husband is a dermatologist, so I met them by chance, and I said, look, guys, I have this idea. I cannot do it by myself. Can we collaborate? So we open up the third company, and the idea is to create a few, products and, help a little bit the skin of the patients. And I didn't expect that we're going to end up exporting in 10 countries at the moment. And except from the, cosmetic line, we have now created a medical grade line. We did a clinical trial with the German Oncology Center. We've been part of, different conferences. Now we have created a beautiful collaboration with Thanos Hotels. Thanos Hotels have beautiful hotels in Cyprus, the Anasa, Almira, and Annabelle. And now we created an inclusive wellness program with them. So it's a program that I'm very, very proud of. And it was one of the difficult moments that I had with my sister. A month before she died, it was a good day for her. So I said, okay, maybe we need to do something, to make her feel a bit better. She was on a wheelchair at the moment, so it was really, really difficult to comfort her. So we said, okay, let's go and visit a spa. So we can have a nice day in the pool. You can have a nice relaxing massage, just to feel human again. Once we enter and we had to go through the health and safety form and complete, about our, health condition, and see tick the part that said cancer treatment. They said, oh, we cannot take you in because we have either non-trained for this type of problems, or we don't have the specific products that they are approved to use on your case. At the end, we end up, be part of the spa. We spent half a day there, and ask her as a personal favor, maybe to massage a little bit her feet and her hands. It was one of the best days that she had in her life. And because I always remember in this, I wanted to create something, for cancer people, cancer patients to feel like human again. So now we have been part of these hotels. We have a very nice ritual for people in need, not only cancer patients with autoimmune disease, cardiovascular problems, diabetes, premenopause, menopausal skin changes. So all the people that they are more sensitive, and they need product for them to make them feel, better and, work on, the longevity of the skin. So skin is something that we normally forget about, but it's the largest organ of our organism. So it's something that we have to take care of it, not only the face, the things that we see in the mirror, but, the whole thing. So for me, it's like, I have a circle that now it's closed, and I'm working on therapeutics. I'm working on biomaterials that can save, the different organs that you might lose during this fight, and then take care of your skin, which is the mirror of your health.
What I loved about, especially this third company, it's this thing about making the patient remember that they're human. It's, for a moment, they can take that patient word out of them and just feel like, I want to pamper myself. I want to feel, because there's something about touching your skin as well. And like when you're rubbing cream or any kind of oil, you do feel like the sensation of like, I'm beautiful and I'm connecting to my body. I think that's when I was reading about especially this last company, I thought, this is such a beautiful thing, because so much research is just focused on trying to get rid of like the cancer. They don't forget the human there. They're not just patients. They still want a quality of life, whatever the outcome is in the end. So,
And you're absolutely right, because this is a whole sector in oncology. It's called integrative oncology. So part of how to touch a patient, the diet, the exercise, the psychology, it's all part of integrative oncology, which is in other countries that they have like they are more advanced in the cancer community, then try to implement this program within the clinics. So we need to bring these things in Cyprus as well. And I'm very happy to say that now we have many clinicians and healthcare professionals that they are looking into implementing these programs. It takes more time, I know. We're always one of the last countries that we follow, the correct clinical trends. But I'm sure we're going to be there.
Yeah, and it's great because I know there's so many other, diagnoses that people get that they feel like it's the end of the world. And it's nice. It's very encouraging to hear that, yes, you do have this diagnosis, but it doesn't mean it's the end of your life. You can still live whilst going through the treatment. And I think it's encouraging also for the people supporting. Because I don't know how connected you are to some of your clients, especially through this last company. But I think I would imagine being somebody who's a support person for the person going through the treatment, to know that, they have this moment of like, I feel human. Okay, let me do my skincare routine.
Yes.
Let me look in the mirror and do this, and having this, okay.
No,
light.
It's great because because we are a small country and we are a phone call away, and people can find you through, the social media. My phone is full of, photos of people that they say, thank you, look at my hand before, look it now. Without the cream, I will suffer, and, I feel human again. So for me, this is success, to care for others, to be useful, and, see the results. So with Theramir, I may not live to see the results, but at least with RSL, you see the impact that you have in the community. And this is beautiful. This is why, you study for many years. This is, how you become useful. And, I think it's a great example for others to follow as well, as an inspiration.
One of the quotes I really like, you even mentioned it yourself, that you want to feel useful. And especially, I guess you took your mother role very early in your life. And right now, it feels like you're kind of continuing that. You are still being like a carer, even for a much larger children's group, I guess. How do you feel that you're doing that for your own children? Do you feel that you are still kind of being this model of, being somebody who not just connects to the world, but kind of uses their time here on earth to create something good?
Look, because I didn't have my mother in the house to feel this, family, and, feel that, you have somebody there to support you, and it's there for you, either to talk to them about, your problems, or even, cook for you, which is like the simplest thing that you can do, offer a plate of food. This is something that I'm doing. And I will do forever. Even if I am very tired, or if I work like the whole day, I'm going back home and I will cook for them in the night. I want on the Sunday to have the very nice Sunday lunch, and everybody has to sit on the table and you have to eat all together to discuss how was your day, how was your week. It's not just, a plate in front of you. It's like, you feel that you are a family, you are a small community. And now you know that they are getting, older, and they're discussing with you, and you realize that they are autonomous human beings. It's, it's unbelievable. And your job as a parent is that, to give them the, to open up the horizon for them, that they can follow their dreams. And, some people, they might say, oh, you're working a lot, you don't see your children enough. No, you see your children, and the children know that you are there for them. It's not just, I'm going to, give them a bath, or, stay 9 hours with them in the day. It's the things that you do, the quality things that you do. And, when the children, they listen, they understand that you are doing. And once my daughter and my son, they told me, Mami Mu, you have to be very proud of yourself. Because, you lost your family, but now you're trying to save other people. So if your child says that to you, I think you've done 50% of your job.
Yeah.
They realize, they are inspired, and they might want to follow your step tomorrow.
Exactly. And I think it teaches them this important lesson of like resilience and strength, and that whatever they have in life, that, they have somebody who can support them. Yeah, you're not with them 24/7, but they know you whatever problem they can come to you with, you're strong enough to handle it. And I think that's a beautiful thing and a beautiful model to kind of show them. What are the values you live by?
I hate lying. I hate lying. And I always want to be useful, as I said before. And I'm always trying to be positive, even, in the darkest moments of life. Be authentic. For me, it's major. I don't want to wear different masks. And, once you enter the business world, you realize that you are not in the safety of the lab. You're not in the safety of science, that, only data talks. You are in a completely different world. So for me, I fight a lot with myself that if I have to wear, a different mask and become, a different Marianna, that I have to lose my romanticism, my, positiveness in this world. So for me to stay authentic and try to make awareness of, what your vision and your passion is, it's really important. To be passionate in what you're doing for the rest of your life, it's something that will keep you, alive. It will give you energy, authenticity for me. Yeah. That's Marianna. Marianna that you see now in front of you is the same Marianna you're going to see in my house, the same Marianna you're going to see at work, the same Marianna you're going to see at a scientific conference, and the same Marianna you're going to see on a business conference. I don't want to change.
With maybe even a deeper question, but the question is, what is the future you are building towards?
Oh, so many hard questions today. For me, it's less pain. Less pain, especially in the oncology field. Less pain everywhere. And I really want to see people collaborating without only thinking of, the financial gains. Once you are successful, money will follow. That's for sure. But I really hate that, and in this, world that now startups are really sexy, unicorns are even sexier. We are losing the point of why creating what we create. It's all about, exit. It's the only thing that I hear. Once I'm going to, ask for money, of course, you have to have a return of investment, but it's all about exit, unicorn. Nobody talks about impact, or if we talk just, to tick the box. Yeah. And we forget that we are humans. How much time do you think that we're going to spend in this world? Not much, I'm telling you. So for me, you have to be useful, and you need to create things with substance and have impact in the community, and be nice to each other. Be positive. I hate enter like a board meeting. I have people to, just wear a mask and just deciding to be strict and make your life difficult. Why? We are all here for the same purpose. So be nice to each other.
That is a very beautiful note to end with. Thank you so much, Marianna, for joining me today. It's been honestly a very positive and enlightening conversation. So I really hope that I'm sure is going to touch a lot of people who will listen. So thank you so much.
Thank you very much for the invitation.
Thank you for watching today's episode. Please subscribe to the Future Media channel, give us a like, and turn on your notifications to never miss an episode. Until next time.